A young boy, barely 5, clutches his stomach, his face contorted in pain. His tiny body, usually brimming with energy, lies listless. This is a sickle cell crisis, a painful episode that casts a long shadow over the lives of millions around the world. Sickle cell anemia, an inherited blood disorder, inflicts excruciating pain and a host of other complications. It affects individuals physically, emotionally, and psychologically. Imagine a life punctuated by episodes of debilitating pain, frequent hospital visits, and the constant fear of complications. This is the reality for many living with sickle cell disease. Yet amidst these challenges, there are stories of resilience, hope, and the unwavering human spirit. With ongoing research and advancements in treatment, there is hope for better management and a cure for sickle cell disease. Join us as we explore the intricacies of this condition and the collective efforts to alleviate its burden on humanity. Sickle cell anemia, a hereditary disease, stems from a flaw in the blueprint of life itself, our genes. Specifically, a mutation in the gene responsible for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. This mutation distorts the shape of red blood cells, turning them from pliable discs into rigid, sickle-like forms. Hemoglobin, the molecule that gives blood its characteristic red hue, is crucial for life. In sickle cell anemia, the defective hemoglobin, known as hemoglobin S, disrupts this vital process. When oxygen levels are low, hemoglobin S molecules clump together, forcing the red blood cells to stiffen and adopt the telltale sickle shape. These misshapen cells are sticky and prone to clumping, obstructing blood vessels and impeding the smooth flow of oxygen-rich blood. This blockage starves tissues and organs of vital oxygen, leading to excruciating pain and organ damage. The deformed cells are also fragile and break down easily, resulting in a shortage of red blood cells, a condition known as anemia. Understanding the genetic underpinnings of sickle cell is crucial for developing effective treatments and genetic counseling for families. Sickle cell anemia manifests in a myriad of ways, each symptom a testament to the disease's insidious grip on the body. Pain, often sudden and excruciating, is a hallmark of the disease. These episodes, known as sickle cell crises, occur when stiff, sickle-shaped red blood cells obstruct blood flow, depriving tissues and organs of oxygen. Fatigue, a constant companion, arises from the chronic shortage of red blood cells, the body's oxygen carriers. Anemia, a hallmark of the disease, leaves individuals feeling drained and weak. The yellowish tinge of the skin and whites of the eyes, known as jaundice, signals the rapid breakdown of damaged red blood cells. The body's organs, starved of oxygen, bear the brunt of the disease. The spleen, responsible for filtering blood and fighting infections, is particularly vulnerable. Living with sickle cell anemia is a daily tightrope walk, a constant negotiation between managing symptoms and striving for normalcy. Despite the challenges, individuals with sickle cell display remarkable resilience, navigating life's complexities with courage and determination. Timely diagnosis of sickle cell anemia is crucial for effective management and improving long-term outcomes. Fortunately, a simple blood test, known as hemoglobin electrophoresis, can definitively diagnose the condition. This test separates different types of hemoglobin based on their electrical charge, revealing the presence of the abnormal hemoglobin S. Newborn screening, now routine in many countries, has revolutionized early detection of sickle cell disease. A few drops of blood collected from a heel prick shortly after birth are screened for various disorders, including sickle cell anemia. Early diagnosis allows for prompt medical intervention, reducing the risk of severe complications and improving overall health outcomes. Prenatal testing offers expectant parents the opportunity to determine if they carry the sickle cell gene and assess the risk of their child inheriting the disease. Chorionic villus sampling, CVS, and amniocentesis performed during pregnancy analyze fetal cells for the presence of the sickle cell mutation. Genetic counseling plays a vital role in guiding families affected by sickle cell anemia. Early diagnosis, coupled with comprehensive medical care and support, empowers individuals with sickle cell to live fuller, healthier lives. While there is no cure for sickle cell anemia, a range of treatments aim to manage symptoms, prevent complications, and improve quality of life. Treatment plans are individualized, tailored to each patient's specific needs and medical history. Regular medical care, close monitoring, and patient education are cornerstones of effective management. Pain management is paramount in treating sickle cell crises. Pain relievers, ranging from over-the-counter medications to potent opioids, help alleviate excruciating pain. Staying hydrated is crucial, as dehydration can trigger crises. Warm compresses applied to affected areas can soothe pain and reduce inflammation. Blood transfusions, a mainstay of treatment, replenish the body's supply of healthy red blood cells, alleviating anemia and reducing the risk of complications. Hydroxyurea, a medication initially developed for cancer treatment, has emerged as a game-changer in managing sickle cell anemia. It stimulates the production of fetal hemoglobin, a type of hemoglobin present in infants that does not sickle. The fight against sickle cell anemia is far from over. Scientists and researchers across the globe are working tirelessly to develop new therapies and, ultimately, find a cure. Gene therapy, a revolutionary approach, holds immense promise for treating the root cause of the disease. It aims to correct the faulty gene responsible for sickle cell anemia. Clinical trials are underway, testing the safety and efficacy of gene therapy in humans, with encouraging early results. Another promising avenue of research focuses on developing new medications that prevent red blood cells from sickling. These drugs target different stages of the sickling process, interfering with the clumping of hemoglobin S molecules or preventing the red blood cells from adopting their rigid sickle shape. Stem cell transplantation, while not without risks, offers a potential cure for sickle cell anemia. Despite these hurdles, the relentless pursuit of scientific breakthroughs offers hope for a future where sickle cell anemia is no longer a life-altering disease. Beyond the medical jargon and scientific complexities lie the human stories of individuals living with sickle cell anemia. These are stories of resilience, courage, and the unwavering spirit to overcome adversity. Meet Sarah, a young woman who refuses to let sickle cell define her. Despite enduring excruciating pain crises and countless hospitalizations, Sarah excels in her studies, volunteers at a local clinic, and dreams of becoming a doctor. John, a middle-aged man, has battled sickle cell his entire life. He has learned to manage his condition, taking his medications diligently and recognizing the early warning signs of a crisis. These stories, while unique, share a common thread: the indomitable human spirit that refuses to be defined by illness. Raising awareness about sickle cell anemia is crucial for dispelling myths, reducing stigma, and ensuring timely diagnosis and appropriate care. Public education campaigns, community outreach programs, and media representation play a vital role in educating the public about this often misunderstood disease. Support groups and online communities provide a lifeline for individuals and families affected by sickle cell anemia. These platforms offer a safe space to share experiences, exchange coping strategies, and find emotional support. Advocacy efforts are essential for influencing policy changes, increasing funding for research, and improving access to quality healthcare for sickle cell patients. Sickle cell anemia is a global health concern, disproportionately affecting individuals of African, Hispanic, and Mediterranean descent. The highest prevalence rates are found in sub-Saharan Africa, where access to healthcare and specialized treatment centers is often limited. Disparities in care, both within and between countries, contribute to significant health inequities for sickle cell patients. Factors such as socioeconomic status, geographical location, and racial bias can influence access to early diagnosis, comprehensive treatment, and long-term management. Global collaboration and knowledge sharing are essential for reducing the burden of sickle cell anemia worldwide. The future of sickle cell anemia research is filled with both challenges and opportunities. While a definitive cure remains elusive, the relentless pursuit of scientific breakthroughs offers hope for a future where sickle cell anemia is no longer a life-altering disease. Gene editing technologies, such as CRISPR-Cas9, hold immense promise for correcting the genetic defect responsible for sickle cell anemia. This revolutionary tool allows scientists to precisely target and modify DNA sequences, potentially offering a permanent cure. Advances in stem cell research and transplantation offer another beacon of hope. Researchers are exploring ways to improve the safety and efficacy of stem cell transplantation, making it a viable treatment option for more patients. Efforts are also underway to expand the donor pool, addressing the critical shortage of matched donors. The quest for new and improved medications continues, with a focus on developing drugs that prevent red blood cell sickling, reduce pain crises, and minimize organ damage. Sickle cell anemia, a disease rooted in a single genetic mutation, casts a long shadow over the lives of millions worldwide. We have journeyed through the complexities of this disease, exploring its causes, symptoms, diagnosis, and treatment. We have witnessed the profound impact of sickle cell on individuals, families, and communities, acknowledging the physical, emotional, and financial burdens it imposes. Yet amidst these challenges, we have also encountered stories of resilience, courage, and the unwavering human spirit that refuses to be defined by illness. Scientists and researchers across the globe are working tirelessly to develop new therapies and ultimately find a cure. Gene therapy, stem cell transplantation, and novel medications offer hope for a future where sickle cell anemia is no longer a life-altering disease. Let us amplify their voices, support research efforts, and advocate for equitable access to quality healthcare. The journey ahead may be long, but the collective determination to alleviate the burden of sickle cell anemia offers hope for a brighter future.